You hear this a lot in bodybuilders. They're like, well, I need, chicken, or I need fish to be, to be strong, to build muscle tissue. That is utter nonsense. The largest, strongest terrestrial animals on the planet are all herbivores. The biggest, strongest animals are all herbivores.
When we bring in people and they're on meaty diets and we transition them to a plant-based diet, we always track what they're eating. Their vitamin intake goes up. Their nutrition overall goes up, dramatically better. And these same people might worry in advance, will I get the nutrition that I need on a plant-based diet? The fact is, you're not getting the nutrition you need on a meat-based diet, and you're going to get dramatically better nutrition on a plant-based diet.
For an average-sized guy like myself, I need about 56 grams of protein a day. That's optimum. Probably I really need 30 to 40 grams a day. Diets that are really high in these protein create diabetes, create heart disease, create cancer, create the diseases that I'm treating on a daily basis.
But this is the opposite of what all the high-protein diet fads say.
The food you eat determines the bacteria that live in your gut. While you eat animal flesh every day, you are summoning up bacteria that eat carnitine. And those bacteria will turn that carnitine into a molecule called trimethylamine. Your liver then turns that into trimethylamine oxide. That's a molecule from hell. That molecule drives cholesterol into the artery walls. And the people who are consuming this flesh-based diet are contributing to plaque building up. They may lose weight on this diet, and that's good. But what's happening inside your arteries, paleo friends? What's happening is that plaque is building up, and these are the folks who drop dead at the gym at 39. Boy, he was lean and he looked really good. But where is that cholesterol going? It's going into your artery walls. So I believe these paleo folks are setting themselves up for an epidemic of clogged arteries, colon cancers, autoimmune diseases. This is not a healthy diet. We are not carnivorous apes.
Humans' closest living relatives are chimps, who get 97% of their calories from plants and the remaining 3% mostly from insects. Comparing the anatomy of true omnivores like bears, who eat both meat and plants, to frugivores like primates, who eat almost exclusively plants, the differences are pretty clear. Frugivore teeth have flat molars for chewing plants, where omnivore teeth are serrated for stabbing and tearing flesh. Frugivore jaws can move forward and back and side to side. Omnivore jaws cannot. Omnivores have much stronger stomach acid for digesting meat compared to less acidic stomach acid of frugivores. The intestines of frugivores is 9 times their body length compared to 3 times for omnivores. This is because meat will putrefy in the gut unless it is moved through quickly. If humans were indeed true omnivores, we would need to change our physiology and appearance quite a lot. But we fit every requirement of a frugivore. We may behave like omnivores, but anatomically, we're frugivores.
Human beings, unlike bears and raccoons, and to some extent dogs, don't have that mixed anatomy and physiology that you see in the true omnivores, and thus we are not true omnivores. In humans, the canines have become really small and rounded and actually function like accessory incisors. They're utterly useless for ripping and tearing anything other than an envelope. So the idea that the mere presence of the canine somehow means that we're supposed to eat meat is silly.
He was right. I always thought my canines were for meat, but what kind of animal could I actually kill and eat raw with these tiny teeth? The thought alone was disgusting.
I mean, everybody loves a smoothie made with fruit and even some vegetables, but if you think about putting a fish or a piece of beef in a blender and grinding it up, the thought is absolutely repulsive.
All these diseases I had learned about were from eating a diet our body wasn't designed for. What would happen if we started eating a diet our body actually was designed for?
The data is crystal clear that you can stop and reverse heart disease with plant-based diets, scientifically shown. I've seen it in my own patients.
People who adopt low-fat plant-based diets can actually reverse their heart disease, and that literally means watching the plaque start to go away, something they didn't think could happen.
My experience with patients is, and those studies show, that when people adopt a fully plant-based diet, their cholesterol levels plummet within a few days. And if you do blood tests in a couple of weeks, you'll see dramatic improvements.
Yes, your numbers are going to look great within a week or two. Your cholesterol can come crashing down. In fact, if you're on medications, your doctor may have to pull off your blood pressure medications so your blood pressure don't drop too low because they can work too good. Like that, the side effect is not having to take drugs.
In a groundbreaking study published by Dr. Esselstyn following patients suffering from cardiovascular disease, 99.4% were able to avoid major cardiac events by going plant-based.
Because it's not just heart disease. It's hypertension, it's diabetes, it's strokes, it's heart attacks, it's several of the autoimmune diseases, lupus, asthma, GERD, osteoporosis. I mean, there's a multitude of diseases, even rheumatoid arthritis. It can be so dramatic. When you see these poor souls with just absolute crippled with rheumatoid arthritis go plant-based, then they come off their medication.
I wanted to follow up with Jane Chapman, who had been suffering from severe osteoarthritis, and I could not believe what I saw after only a few weeks of fasting and changing her diet.
So it's so amazing to see like this only a few weeks later.
I know. From going from the walker, needing wheelchair assistance at the airport, to strolling down the street, enjoying the fresh air, the sunshine. 2 weeks. It's all it took, 2 weeks to get off all the meds and start to feel the inflammation just kind of drain out of the body, where the movement was much easier. Just a lot of healing occurred very, very rapidly just by doing the right things for your body.
When you're treating diseases with drugs, you know, there's one drug you take for cholesterol, a different class of drugs you take for high blood pressure, different class of drugs you take for diabetes. But with diet, a plant-based diet affects all these diseases. Inflammatory bowel disease like Crohn's, the best remission rates ever achieved through a plant-based diet. MS, multiple sclerosis, the best results ever achieved compared to any medical, surgical, any kind of intervention was a plant-based diet.
You can see that with every sequential reduction in animal products, people live longer, they have less heart disease, they have less cancer, they have less diabetes.
You can actually take human cancer cells, put them in a petri dish, and you can drip the blood of those eating vegan, get about 72% suppression in human prostate cancer cell growth in vitro. They wanted to try this again with women and breast cancer. So they said, let's see what a plant-based diet can do. After just 2 weeks, their bodies cleaned up. You drop their blood on the same carpet of cancer cells. You can clear off the whole plate. This is after just 2 weeks eating healthy, which raises the question, what kind of blood do we want in our bodies?
My background is in industrial and systems engineering, and that was my career path for a long time until I got thyroid cancer, and everything changed from there. I decided that I wanted to try alternative methods and treatments rather than have surgery and have my thyroid removed, which meant I'd be on medication forever, and I didn't want that. I just started reading how a plant-based diet can heal the body, and it has worked for so many people. So I immediately just switched to a completely whole food plant-based diet. After a year, the cancer was completely gone, and my thyroid had shrunk to normal size, and I was completely free of that.
This was tough to believe. Couldn't this all just be from eating healthier though, like no sugar? Turns out Dr. Walter Kempner from Duke University back in the 1940s was reversing some of our worst killer diseases with diet alone. And the diet he was using was not only strictly plant-based, but it was made up of white rice, fruit, and table sugar.
And he was reversing diabetes, he was reversing malignant hypertension, reversing heart disease, the diabetic complications, reversing diabetic blindness. So these people basically had death sentences, went to him, and were given basically sugar, this horrible diet, but it was strictly plant-based.
If this information had been around since the 1940s, why don't all doctors know this?
We're not taught about the power of food in medical school. No one is taught that the changes that we make with our diet are probably the single most powerful thing we can do to determine our destiny. It trumps our genetics.
Why isn't your doctor telling this? Odds are your doctor never learned any of this. In fact, there was even a bill introduced just mandating physicians get 7 hours nutrition training every couple of years, just to kind of stay on top of it. And who came out against that? The California Medical Association. Even the family physicians, the surgeons, all the mainstream medical groups came out opposed.
It's 7 hours. That's a lot, even if it's over 1 4-year period.
So they're not just kind of neutral, but they're actually actively opposing nutrition education.
Ironically, when patients come to doctors with questions, they assume that the doctor knows something about nutrition, and so it's kind of a double whammy that doctors haven't been taught much about nutrition.
Why don't we hear about this from dietitians when nutrition is their entire specialty? Turns out the American Nutrition and Dietetics Association puts out nutrition fact sheets written by the industries themselves. The industries pay $20,000 per fact sheet and explicitly take part in writing them. So you can learn about eggs from the egg industry, and you can learn about lamb from the lamb industry. This would be like learning about the benefits of smoking from the tobacco industry.
When people are eating meat, I think of it as a bit like smoking. it's sort of Russian roulette. You may not get diabetes, but your chances of getting diabetes, about 1 in 3. You may not get cancer, but your chances, if you're a man, about 1 in 2. A woman, 1 in 3. Your chances of gaining weight, 2 out of 3. It's not all diet, but most of it is. The best thing that you can do to make sure that you empty all those bullets out of the chamber and you're not taking risks with your health is to get the animal products out of your diet and eat healthy foods.